Hello everyone, today we'll discuss about sleep physiology. Now, what is sleep? It is naturally or artificially induced state of suspension of motor and sensory activity. It is a state of mental and physical relaxation. Sleep is also defined as loss of consciousness from which a person can be aroused by sensory and other stimuli. Now, during sleep, consciousness as well as power of will, they are partially or completely suspended, and body activities, they are also greatly reduced. Sleep is considered to be an active state. Sleeping brain consumes as much energy as the awake brain, and sometimes it consumes even more energy, and therefore sleep is considered to be an active state. Sleep, it is a state in which there is loss of critical reactivity to the events in the external environment. Depth of sleep is not constant throughout the sleeping period. Requirement of sleep in newborn babies, it is about 18 to 20 hours. In children, 12 to 14 hours of sleep is required. In adults, 7 to 9 hours, and in old age, 5 to 7 hours of sleep is required. Now, control of sleep-wakefulness cycle. There is a biological clock which controls the circadian rhythms. Center for this clock that is present in the suprachiasmatic nucleus of the anterior hypothalamus. Sleep-wakefulness cycle. This is endogenous rhythm, and external cues, they regulate this endogenous rhythm. Fibers, they pass through retina to the hypothalamus through retino-hypothalamic tract. Various factors, they affect sleep. They are decrease in the sensory inputs, like if we are there in the dark room with a relaxed body posture, there is a silence, comfortable warm surrounding is there, and low frequency stimulation sometimes also induce sleep, like when we are patting or knocking in cradle or sitting in a moving vehicle, we can easily fall asleep. Anxiety and the emotional stimuli, they release epinephrine, and that results in the activation of reticular activating system, and that results in wakefulness. Sometimes in absence of all these factors also, we can fall asleep, like while reading. You can see. Now, various physiological changes, they occur during sleep. Change in the plasma volume. Plasma volume decreases by about 10% during sleep. Cardiovascular system. Heart rate. Heart rate decreases during sleep. It may vary between 45 to 60 beats per minute. Blood pressure also falls about 90 to 110 millimeter of mercury, and the lowest level of the blood pressure is reached at about 4th stage of sleep. Vasomotor tone decreases and cardiac output also decreases. Respiratory system. Rate and the force of respiration decreases. Pulmonary ventilation also decreases. The respiration becomes irregular, and chain-stop type of periodic breathing may occur. Basal metabolic rate is also reduced by about 10 to 15% during sleep. Secretions. Sweat secretion increases, whereas lacrimal and salivary secretion decreases, and gastric juice secretion may remain normal or increased. Effect of sleep on the excretory system. Urine formation decreases, phosphate content and specific gravity increases. Muscle tone. Tone of all the muscles of body decreases except ocular muscles. You can see here. Tone of the skeletal muscles in the neck is also markedly reduced. You can see here, when we fall asleep, we can fall down. eye movements. You can see eyeballs, they roll up and out. It is due to flaccidity of external ocular muscles. Central nervous system. EEG changes we will discuss separately. Reflexes, they are abolished. Threshold for the reflex is increased. Babinski sign is positive during deep sleep. Light reflex is retained. Pupils, they are constricted. And vasomotor reflexes, they become brisk. Types of sleep. Neurophysiologists recognize two types of sleep. They are REM, that is rapid eye movement sleep, which is also known as paradoxical sleep, and second one, that is non-rapid eye movement sleep or slow wave sleep. You can see here, this is the normal sleep pattern. This one here, this is REM sleep period. This is one cycle, sleep cycle. Each sleep cycle consists of NREM part and REM sleep. REM sleep, it is the type of sleep which is associated with rapid conjugate movements, which is also known as saccadic movements of the eyeball, and it is also known as paradoxical sleep. Duration of REM sleep, you can see here this one. It is only 20 to 30% of total sleep period, and it varies from 5 to 30 minutes in each sleep cycle. This is one sleep cycle, you can see, and this is the duration of REM sleep in each sleep cycle. Now, functions of REM sleep. REM sleep is important for consolidation of memory, as it is known as paradoxical sleep, because the sleeping person, REM sleep is also known as paradoxical sleep because the person is difficult to arouse from this phase of the sleep, and this phase of the sleep is having desynchronized EEG activity, which is the characteristic of alert and awake state. Now, characteristic features of REM sleep. It is associated with active body movements. In this phase of sleep, arousal is difficult. In the morning, arousal is during REM phase of the sleep. It is also known as dreamy sleep. Heart rate and respiratory rate becomes irregular during heart rate and respiratory rate becomes irregular during REM sleep, and here rapid eye movement is seen. Muscle tone is reduced. There is marked decrease in the skeletal muscle tone, and that is the reason for snoring. Snoring is due to obstruction of the air passages by the tongue, which is fall down in the supine position. EEG wave in the REM sleep, they are similar to wakefulness, and this is the reason, as we have discussed, it is known as paradoxical sleep. In REM sleep, twitching of the limb or teeth grinding, that is known as bruxism, that is also present. In cats, REM sleep is associated with PGO waves, also known as PGO spike. Full form of PGO is pontogeniculo-occipital wave. It is associated with large phasic potentials, and these potentials are present in the group of 3 or 5. These PGO spikes, they originate from pons and they pass rapidly to the lateral geniculate body and then to the occipital cortex. It activates the reticular inhibiting areas in the medulla oblongata and it reduces hypotonia. Now, clinical significance. When the subject is aroused repeatedly in the REM phase of the sleep, subject becomes irritable, and on subsequent night duration of REM sleep is increased. REM sleep allows the expression of the thought through dreams. REM sleep is also required for long-term chemical as well as structural changes which are required for learning and memory. And when any animal or the person is deprived of REM sleep for a long period of time, weight loss is observed in spite of increased caloric intake. And therefore you can say that REM sleep is very important for the homeostasis and mental well-being. Now, barbiturates and monoamine oxidase inhibitors, they decrease REM sleep and it has psychological effect. Rapid eye movement sleep is also known as desynchronized or fast wave sleep or paradoxical and dreamy sleep. Various behavioral changes they occur during the REM sleep. It is deep sleep, person cannot be aroused or it is difficult to arouse during REM sleep, and it is dreamy sleep as we have discussed. Next type of sleep, that is non-REM sleep, also known as slow wave sleep. Here there is no movement of eyeball. Duration of this sleep is about 70 to 80% of total sleep period, and it is also known as dreamless sleep. Dreams are not present, or you can say if dreams are there, they cannot be remembered, and it is restful sleep. Physiological significance of slow wave sleep. Here during the slow wave sleep, there is pulsatile release of the growth hormone as well as gonadotropin from the pituitary. Slow wave sleep. Another physiological significance is slow wave sleep is a period of rest and metabolic restoration. This slow wave or NREM sleep is further divided into 4 stages. They are stage 1, 2, 3 and 4. Now, these stages are according to EEG pattern. Stage 1, which is also known as stage of drowsiness. Here you can see in the first diagram, you can see here stage 1. In stage 1, alpha waves, they decrease in the frequency and they are abolished, and there is presence of low voltage waves as well as infrequent delta waves, they appear. There is presence of low amplitude and mixed frequency waves. Still, the person is sensitive to the sensory stimulus. Stage 2, which is also known as stage of light sleep. Here, there is appearance of sleep spindle, you can see here in the diagram. This sleep spindle superimposed by low voltage delta waves during this stage. Now, what is sleep spindle? They are short spindle-shaped bursts of alpha waves that occur periodically, and the frequency of sleep spindle, that is 14 to 15 Hz. Auditory stimuli during this phase evoke K complexes. You can see here in the diagram K complex. So K complex, it is 1 or 2 high voltage wave which is followed by brief 14 Hz activity. Stage 3, which is also known as stage of medium sleep. Here sleep spindles, they disappear and there is presence of delta waves with low frequency and large amplitude. And stage 4, which is a stage of deep sleep. Here delta waves with low frequency and high amplitude, they are present. So again 4 stages. Stage 1, here in stage 1, eyes are closed and relaxation begins. EEG shows alpha waves and here person can be easily aroused. In stage 2, EEG pattern becomes irregular and sleep spindles, which are high voltage wave, they are present. Here arousal is difficult. Stage 3, deep sleep, theta and delta activity appear and vital signs decrease, heart rate, blood pressure, they decrease, they start falling. Stage 4, EEG pattern shows delta wave skeletal muscles, they are relaxed and arousal becomes difficult. Now, behavioral changes during sleep. There is progressive decrease in the consciousness. You can say in third and fourth stage of slow wave sleep, it is very difficult to arouse the individual. And during this stage 3 and 4, the person does not report dreaming. Discriminative responses, the person responds to meaningful stimuli. Okay. You can see here, this is the sleep pattern in young individual and this is in the older individual. Now, intellectual functions during non-REM or slow wave sleep. They are illogical and incoherent thoughts are there, and sometimes the person is having retrograde amnesia. Person cannot be able to recollect the past information. Now, sleep cycle. If average period of sleep, suppose it is 7 to 8 hours. So you can say in this 7 to 8 hours we have about 5 sleep cycles, because duration of one cycle is about 90 minutes. So you can say 1.5 hour. So 5 cycles in our 8 hours. From this 5 cycles you can say 70 to 80% is non-REM sleep and 20 to 30% is REM sleep. Duration of REM sleep increases progressively. You can see here in first hour this much is the duration of REM sleep. Then you can see progressively it increases. It is highest towards morning time. Again you can see here in this diagram typical sleep stage cycle. It shows REM stages. It shows REM and non-REM sleep with different stages. So you can see slow wave sleep or NREM sleep precedes REM. So first is we have NREM, this one, followed by REM. And REM sleep duration increases over the period of night. So in the morning we have more REM sleep, and this is the reason we feel we have dreams in the morning. As we have discussed, duration of one sleep cycle, this is one cycle, is 90 minutes. Okay. This is again you can see NREM and REM sleep and that duration. This shows various stages. After person is having NREM sleep, you can see 1, 2, 3, 4 stages these are. Then they are all are reversed this way, then they are reversed. Okay, 4, 3, 2, 1 you can see in the diagram, and which is followed by REM sleep. So you can see this is downstroke and upstroke, means 1, 2, 3, 4 followed by 4, 3, 2, 1, and then there is REM sleep. Now, duration of third and fourth stages of NREM sleep is maximum in the first cycle. You can see here third and fourth stage, they are maximum in the first and maximum in the second cycle, and then they decrease progressively. You can see the slope is like this, then upward, then like this. So third and fourth stage may be absent in remaining sleep cycle, and duration of second stage of NREM sleep increases progressively. And in the morning the individual periodically awake during later sleep cycles. Now, genesis of NREM sleep. It is by interaction of neurons which are grouped as produced by stimulation of 3 subcortical regions. They are: one is diencephalic sleep zone, second is medullary synchronizing zone, and third, that is basal forebrain sleep zone. Starting with first, diencephalic sleep zone, that is present in the posterior hypothalamus and nearby intralaminar nuclei and anterior thalamic nuclei. Anterior thalamus, which has a facilitatory center, and posterior thalamus has waking center. When we are stimulating with low frequency, this results in the sleep, and faster stimuli produces arousal. So you can say regularly repeated monotonous stimuli, they put the child to sleep, like we are patting the child, and that is because of stimulation of the afferent from the mechanoreceptors in the skin, and which generates synchronized activity of the diencephalic sleep zone. Second center, as we have discussed, medullary synchronizing zone, that is present in the medulla, in the reticular formation of the medulla oblongata, that is present at the level of nucleus tractus solitarius, and it produces sleep on stimulation at low frequency, and when we are stimulating it at a higher frequency, it results in the arousal. Its mechanism is not known. Third area, that is basal forebrain sleep zone. It is present in the preoptic area and diagonal band of Broca's. These are different from other two zones, and they produce sleep on stimulation at higher or lower frequency. Neurons in the ventrolateral part of the preoptic area project to the tuberomammillary nucleus, and which is a part of posterior hypothalamus, that is in the diencephalic sleep zone. So this is all about REM and NREM sleep. We will discuss physiological significance of sleep and sleep disorders in our next video. Thank you.